Hello, I'm sharing a case of a patient who developed a bowel obstruction 48 hours after a TEP, TEP inguinal hernia repair. It was done by another surgeon 2 days ago. Patient developed nausea and vomiting and bowel obstruction, came back to the emergency room. I was on call when the gentleman came in. A CAT scan was read as ileus, but overnight he really didn't look any better and was having a little bit worsened pain, and I elected to take him to the operating room. And you can see there was a peritoneal hole which allowed for bowel to go into the pocket that was created during the TEP inguinal hernia surgery. You can see the mesh there, nice position. That's the lipoma nicely behind the mesh. And just that little hole was enough for the bowel to go in and lead to the symptoms that the patient had. And so I was happy that this is all that the issue was, a quick, easy fix. I chose to use a V-lock suture to just close this defect. I do not myself perform a lot of TEP, TEP inguinal hernias. When I did do them, I was always concerned about holes like this that maybe I would miss or have a much harder time closing from a TEP approach versus a TAP approach. But obviously these types of problems can happen no matter what approach you perform on a patient. And it's just something that we should be aware of because with a lot of the extraperitoneal repairs that we're doing these days, these things can happen with increasing frequency, as well as the fact that imaging doesn't always show that this is what the problem is, and you just have to have an index of suspicion. So if this was the case, it took all of maybe 10 minutes, and the patient did very well with a very prompt return of bowel function and a discharge very quickly after the operation. I hope you enjoyed.